The Gauteng Health Department is investigating allegations into the state of Helen Joseph Hospital after a white patient posted a series of videos outlining poor treatment from staff and the appalling conditions of toilets and other facilities in the hospital. On Saturday morning, Tom London posted an 8-minute video on his Facebook account detailing his experience and labeling it the Helen Joseph Circus Hospital.
They treat the patients like cockroaches. No doctor, I haven't seen one doctor walk up to a patient in our ward and go, "Good morning, Mr. So-and-so, how are you?" Nothing. They treat the patients with absolute disdain and disrespect. I'm talking about this from the young Wits medical students all the way up the chain at this hospital. I have never seen a level of disrespect for human beings like this in my life.
According to Tom London, he was rushed to hospital on Wednesday, 25th of August, because he had a severe lung infection and needed medical treatment. In his videos, he detailed that there is no running water from basin taps, only 2 dirty toilets with no toilet papers that patients need to use, and the disrespect medical staff show towards the patient. He alleged that there were no bathroom facilities for him to use when he got to the hospital, which then resulted in him lying in his own feces for the day. Before he put up such a fuss at the hospital and then being moved to a different ward, the doctors were there calling him by name, calling him feces, making fun of him, bullying him. Every doctor there assumes that every patient is from the streets, is a hobo. They don't care about the patients, and their behavior towards the patients is very appalling, to say the least. He further alleged that there was a dead patient in the ward who was dead for at least 20 minutes. The dead patient was located opposite London's bed. In his video, he says he's dead. He died 20 minutes ago. He's lying there in that bed and he's dead. The doctors are here not paying attention to the dead patient. They even gave the patient a bad name. All of you are despicable human beings, he continues to say in his video.
And I decided I've had enough of the treatment by the doctors. I don't feel safe in this hospital, and I'm not happy with flies coming from a dead guy for hours and coming and sit on me. I think I'm going to RHT myself out of here, and I'm going to try and find another way to get a healthcare solution for my problem.
First of all, how many Black people have highlighted or exposed the injustice and unfair treatment of patients in these public hospitals? How many people have complained about the medical staff not treating patients right? How many Black people have filled the complaint box over and over again? How many Black people have gone to the media to complain about the unfair treatment and the disgusting treatment of patients in public hospitals? Thousands and thousands. But because Tom London is a white man and the Black government is scared of being exposed by white people, they called the Department of Health to go and investigate because their master is complaining. Their master is not happy about the treatment. Screw the Black people that complain on a daily basis. We don't care about them. We don't care whether they complain, as long as they receive medical treatment. By the way, half medical treatment, the rest you will fix at home. They don't care, but the master has complained and it has garnered attention, and now the ministers are at his mercy. The media is covering it and they're acting like they are going to fix it. That was weird. That is so weird that, we are tiptoeing around white people. Why is he complaining about this unfair treatment while we were complaining but nothing was done? Why is his voice much more important than the Black voices? Why is his voice taken seriously? Why is his voice louder than the other Black people? Why is his complaints much more important than the Black people's complaints? I've complained so many times, but no one took me seriously. I'm even here on the African diaspora complaining about public hospitals, but no one's going to take me seriously. So what makes Tom London more important than me? That is what I want to know. Why is the government tiptoeing? Why is the government all of a sudden active in addressing such issues? That is what I want to know. He's no different from us. He bleeds. He's flesh and blood. Unless he's Jesus. I don't know. Maybe he's Jesus.
How's it, my man? I'm the guy you're talking about. I have wondered, is it because I'm white that I'm being taken seriously? It is a possibility. But I think it's because I used to be a talk show host on 702, and everyone in media has crossed my path and know who I am. And it's probably because most people in media know me. I have the capability to make viral videos that I've been able to shake the tree so much. But I'll leave the possibility open that I'm being taken seriously because I'm white. And if that's the case, I'm going to use that white privilege to speak on behalf of all the whites, coloreds, blacks, and Indians who are being mistreated in our healthcare system. I'm going to do it with pride. I don't say this with any disrespect, but if I have to be the voice for everybody who's been mistreated, I'll be the voice. And I hope you'll forgive my skin color, brother.
This is unfair. This just shows that the inequality in South Africa it runs deep. We still have a long way to go. Black people in South Africa are the only ones seeing the Rainbow Nation. White people only see the Rainbow Nation when you are inferior and subservient to them. When you are beneath them, that is when the Rainbow Nation applies to them. But until then, you are on your own. And the government is showing you right now that they do not prioritize black people, the black majority. Only when the minorities are complaining, that is when they're going to start acting like we, South African government, we are working so hard because we are in the government of national unity and the DA is going to hold us accountable for our bad action. So we need to impress the DA of the GNU and the Freedom Front Plus to show that we are working. I mean, how is the NHI going to be implemented when doctors and hospitals are in such conditions? The working class is not going to allow itself to be reduced to the private hospitals when they can have access to private hospitals. They're not going to allow themselves to be reduced like that so that we can all be equal. If inequality is what prevails in South Africa, let it be so across all races and across all working classes. That is just my 2 cents. What do you think about this segment? Comment to us in the comment section below. Don't forget to like and share the broadcast. Subscribe to our YouTube channel. Hit that notification bell so you don't miss these groundbreaking conversations right here on the African Diaspora News Channel.
Introducing the African Diaspora News Channel app, your gateway to stories that's overlooked by the corporate mainstream media.
And we serve as the voice to the Chofao Black community.
Again, we got Dr. Candace Matthews.
A lot of these documents, looking at.
We are committed to informing and educating through the power of media.
This country is supposed to be about the land of the free for all. It has not been free for black people, and we are tired.
With our platform, we're helping to end injustice by exposing it.
Join us in standing for excellence in journalism and serving our community. Download the African Diaspora News app.